Anyone who has discomfort due to osteoarthritis, joint trauma, spinal issues, or common sports-related injuries knows the road to recovery can be difficult and painful. Northwest Center for Regenerative Medicine is looking to change that road.
Regenerative medicine is trying to use your body's own healing elements and encouraging it to heal those areas that it's failed to.
I think when people hear regenerative medicine, they usually think of things like snake oil and things that are going to maybe turn back the hands of time. I don't think that's really accurate. I think regenerative medicine probably is better explained by just keeping you in as good a shape as you can for as long as you can.
While there is a lot of understandable skepticism in the field of regenerative medicine, because this is an evolving scientific field, regenerative medicine is not only a beneficial alternative to traditional medical treatments, but also provides a less invasive option than conventional surgery.
So the research behind regenerative medicine continues to evolve, and we've learned a lot over the past 10 years. We now know that dose is very important, and this is common sense. With anything in medicine, it's important to have an adequate therapeutic dose to get the result that you want. And so, for example, for knees, we now know that if you're using mesenchymal stem cells, you need to have 500 million cells to get a good response or more. When you're using platelets, you want at least 5 billion, but ideally 10 billion cells to get a good response. So in the future, as research continues to evolve, we'll further refine the dosing to help people get the most optimum response and live their best life now.
The center is set up very well to accommodate people that are having stem cell therapies. When I came in, really I was not afraid of getting the cells out of my bone marrow or having them injected back in. I had no complications whatsoever. Before I had the therapy, the tears caused me so much pain. I couldn't walk uphill very well. And the aftermath of the treatment, I was on gradual slopes within 2 weeks. So it was really a very good progression.
So my experience here has been extremely pleasant. I've had good interactions with Dr. Lewis. I feel super comfortable with moving forward with doing the stem cells with him. He's informed me and gave me good knowledge of what to expect. And so I feel like this is the right thing for me.
Regenerative medicine may be a beneficial, cost-efficient model that could maintain and advance your quantity and quality of life. At the Northwest Center for Regenerative Medicine, the emphasis will always be continuing to evolve with an ever-expanding field of science, using not only the latest technology, but always including a human touch.
In the last 5 years, we've mainly been honing down on specific doses of platelets or stem cells, specific concentrations that are helpful for different diagnoses. And so we've really been able to get a better idea of what's effective and what's not. One of the newer treatments is for arthritis of the knee. Instead of just going into the joint where the cartilage is, to inject actually into the bone, just below the cartilage, and putting this additional cells there. And so now we're doing injections for the severe arthritis into the bone itself, as well as into the joint, kind of getting both sides of that cartilage, and we're getting better outcomes.
The difference between using fetal tissue stem cells versus autologous stem cells, which are stem cells that come from your own body, is really quite remarkable. First of all, fetal tissue, when you isolate fetal tissue, there's a very low likelihood that you'll actually have any stem cells in that tissue. In fact, studies show that you're only going to have stem cells in about 10 to 20% of the samples, meaning 80 to 90% of the time, there's no mesenchymal stem cells there. When you take your body's own cells, we know that those cells are healthy. And in the laboratory, after those cells are concentrated, viability testing and cell counting is performed to make sure that you're getting an adequate dose when it's re-injected back into areas where there's been tissue damage.
you can keep yourself healthy and well for as long as you can. That's really the key. And I think that's what I've noticed. What really keeps me coming back to Dr. Lewis is trying to keep the little aches and pains from big aches and pains, and keeping me active on my bike and playing hockey and skiing and doing all the things I like to do.
So in general, the future of regenerative medicine will have to do with refining the dose and the processing techniques to maximize the dose of the cells that you want and minimizing the dose of the cells that you don't want in treatment. On the horizon is the ability to culturally expand stem cells and store those stem cells for later use. Unfortunately, that is not available in the United States currently due to regulatory issues, but the technology exists and is currently evolving.
As regenerative therapeutics techniques continue to evolve, new evidence gives us a bright future in regenerative medicine. For more information, visit nwc4rm.com.